their first meeting, and I'm so excited about that. And I just want to thank everybody that is behind the scenes that has managed to build everything and to make everything come up to this time. Ms. Olive Thomas and your team, thank you so much for a good job well done, and I hope I won't let you down. So today we are discussing on breast cancer, like I mentioned, and it is important to know that breast cancer really is affecting a lot of people in the world. According to the statistics that were put forward by World Health Organization, in 2020, 2.3 million women were diagnosed with breast cancer. And out of that, 685,000 women died as a result of breast cancer. So in Zimbabwe, actually, it's 6 to 8% of women succumb to breast cancer in Zimbabwe. So we're seeing that this is really taking effect in our world, and it's something that we should get to talk about and something that we should get to explore. So today, in helping me do that, we have Professor Makunike-Mutasa, who is a histopathologist trained in the UK and fellow of the Royal College of Pathologists, European Board Certified, and fellow COPESA. Sorry if I butchered that a little. She is also the professor of the Histopathology Unit, University of Zimbabwe College of Medicine and Health Sciences, consultant pathologist for Lancet Laboratories, founding and current registrar of College of Pathologists, East, Central, and Southern Africa, and she's the country advisor for the Royal College of Pathologists. She is also the chairman of Zimbabwe National Cancer Registry, vice chair for Scientific Industrial Development Center, board member for Cancer Safe Trust, board member for United Methodist Health Board, current serves on the COVID-19 Experts National Committee Advisory Committee. She is passionate about teaching and outreach as well as women's health issues. She is also the wife to Ezekiel Mutasa. Prof, we actually welcome you and we thank you for allowing us the opportunity to share this moment with you so that you can educate us and educate the nation on the issues to do with breast cancer. And without taking much of your time, Prof, you're going to explore on the importance of screening and early detection, and you're also going to explore on understanding your pathological reports and how they influence your treatment and cure. So over to you, Doc. Prof, sorry.
No, thank you very much, Tatenda. Thank you for that warm welcome, and may I congratulate you on founding this wonderful organization. As young as you are so visionary. I congratulate you, and I pray that the Lord will continue to enlarge your territory. I also want to thank Olive for the invitation. I assume that we are going to be on until 7 o'clock. Is that correct, Tatenda?
Yes, that's right.
Okay, all right. So I hope I am enabled. Okay, could somebody enable me to share my screen? It says host disabled participant screen sharing. So if you could make me host or co-host so I can share my screen. I have a PowerPoint presentation, which will make it easier to understand.
All right, Prof, let me work on that.
So if you just go to participants, go to my name, right click and allow me to be host, then that's probably the fastest way.
Okay. Okay.
So while we, yeah, thank you, super.
Done.
Yeah, thank you very much. Okay, so as Tatenda says, my presentation is going to cover two areas that I deal with almost on a day-to-day basis. I'll try not to make it too technical. Some of the slides may seem a little bit technical, but I will explain it, and I'll also send it to the organizers on PowerPoint. So if people want to revise things, then they'll have all the information. That's the only reason. So I'll just start with a very simple definition of what cancer is. Sometimes people are confused and they think cancer is just one disease. It's not one disease, it's many different diseases, but what binds all these different diseases together is that in all of the different cancers, whether it's the breast, the cervix, the skin, the prostate, the brain, it's basically abnormal and uncontrolled growth of cells. So we all know that our body is made up of cells, and if the cells in a particular organ just start to grow and grow and grow and don't listen to any signals to stop them, that is cancer. October is designated Breast Cancer Month, so we're in October and we're talking about breast cancer. Is it important to talk about breast cancer? Very, very much so. It's the third most common cancer in Zimbabwe, whether you look at males, females, black, white, it's the third most common cancer. It's the second most common cancer in Zimbabwean women from 2017 till now. Most of my data will be in reference to the 2017 Zimbabwe National Cancer report. So we haven't done 2018, 2019, 2020 yet. The latest edition is 2017. But those of us who are practitioners know that the figures are even worse than what I'm presenting now. Breast cancer makes up 13.5% of the female cancers in Zimbabwean women. So it's an important cancer. This just shows a table that shows you the relationship of all the cancers in females in Zimbabwe. Cervical cancer of the uterus is, of course, much more common. This was 2015 figure, so it's got 11.9. Now we're up to 13.5. Then other cancers are far much less. So it shows you how important breast cancer is. And unfortunately, breast cancer is on the increase in Zimbabwe. It's just going up and up and up and up. And this shows you from 2005 till 2017. And as I said, it's even higher now. 2018, the figures went beyond that, 2019, 2020. So you're seeing a trajectory of an increase in breast cancer. So it's important for us to know it and to understand and see what we can do to prevent dying of breast cancer. Can we prevent getting breast cancer? Unfortunately, no. Why can we not absolutely prevent breast cancer like we can prevent cervical cancer? It's because we don't really know what causes breast cancer. We know a lot of things about breast cancer, but we don't know what exactly causes breast cancer. We know what the risk factors are, and the risk factors include just being female, much more common in females than in males. Only 1% of breast cancer occurs in males. So as women, we are very much at risk. You can also go onto the internet and check what your risk is. There's this thing called BRACT, which is a breast cancer risk assessment tool. You can download it or just do it online. And it will just ask you questions about who you are, what your family history is, what age you are, and it will give you a rough estimate of how much at risk you are. Some of the things that we know about breast cancer is that the older you get, the more likely you are to get breast cancer. The peak incidence worldwide, not just looking at Zimbabwe, is 75 years of age, but it's different for the different races. Caucasians, it amounts, the average age is about 61, whereas for people of color, blacks like us, it's 46. So we can see that we are at risk of getting breast cancer younger in Zimbabwe as Black Zimbabwean women than women elsewhere in the world. So don't just think, oh, breast cancer is a disease for my mom, my grandmother, my aunts. It could be a disease even for a young woman who is recently been married. Some of the risk factors are how long you have been reproductive. So menarche is when you start your periods. Menopause is when you pause or stop your periods. So people who have started their periods quite early, some girls start menstruating at the age of 8 or so, and other women continue to menstruate until they are 60 or 70 years of age. So the longer that period is, the more likely. Age at first live birth. If you had your first child after the age of 35, you are more likely to have breast cancer. If you have never breastfed because you were never pregnant, or you had babies but you chose not to breastfeed them, you're also very much at risk. And if you never ever got pregnant, you are very much at risk of getting breast cancer. Another risk factor that is very important is family history. So you need to know what your aunts, your father's sisters, your mother's sisters, your mother, your grandmother, what people died of generally. And if you have a relative who had breast cancer, you are at risk. If you had a relative on your mother's side, you are more at risk than a relative on your father's side. If you had a relative who had breast cancer quite young, you are even more at risk. So your mother's relatives confer a higher risk than your father's relative. So a mainini and maikuru rather than a tete, but both of them confer a risk. But take heart, 87% with a positive family history will never develop breast cancer. But still, you need to know about your family history. Race is much more common in fair-skinned people, Caucasians, and it's rarest in people of color. So Africans, Asians, they are less at risk. However, when people of color like us do get breast cancer, number one, we tend to get it at a much younger age. We are more likely to be ER negative, as we'll talk about later. We tend to present at a later stage, maybe due to lack of information. And unfortunately, it tends to be more aggressive Black women. So this is a photograph of a specimen that I had. This was a patient of mine, and this was her breast that was removed, and it was sent to the lab. And you can see that she had left it too late. It was now ulcerating through the skin, and it was fungating and very smelly. Nobody wanted to be near her, but she had left it far too late. This is that was a Black woman. This is a Caucasian woman. You can see the skin is white, but she also presented very late. You can see the tumor has already gone through and ulcerated through the nipple. So it's important to pick it up early, and we're going to learn shortly that early detection definitely saves lives. Other risk factors are genetics. People say, so what's the relationship between my aunt having had breast cancer